2.
Hello, everybody. Good afternoon, and welcome to a weekly media briefing and public health update with Montgomery County Executive Marc Elrich. Happy New Year, everybody. I'm Lorna Virgili, Hispanic Public Information Officer for the county. And joining us today is Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, as well as Health Officer Dr. Kisha Davis, and Mr. Sean O'Donnell, Program Administrator, Public Health, Emergency Preparedness and Response for the Department of Health and Human Services. Members of the media, do remember to use the chat when we open it up for the Q&A portion of this presentation. Thank you for joining us, and good afternoon to you, Mr. County Executive.
Good afternoon, everybody, and Happy New Year, and thank you for joining us on our first briefing of the new year. Today, I'm joining you from Cambridge, Maryland. It's the site of the Maryland Association of Counties, or MACO, Winter Conference. This meeting allows leaders from Maryland's 24 jurisdictions the chance to share information and discuss ways that we can jointly deal with issues that are affecting people and communities around the state. And tomorrow, Governor-elect Moore is going to be here as well, so it'll be an opportunity for other conversations with leadership at the top of the state. For Montgomery County, one of our goals is to share with the state lawmakers our vision to expand projects like bus rapid transit to help our county increase mass transit options and provide options, faster options for people to get around that will improve the quality of life for those who ride today and encourage others to use mass transit. I also hearken back to a newspaper article that was done almost 5 years ago where business leaders in the region cited the lack of transportation and specifically the lack of an adequate bus system as a major impediment to economic development. And we know that in Montgomery County, as great as the Red Line is, we don't have adequate north, south, or east-west transportation within the county, and building out a BRT system would allow us to start addressing that and help people get to work, make them less dependent on their cars. I'm also looking forward to talking about our new deal with the University of Maryland College Park, University of Maryland Baltimore, and UMMS, the University of Maryland Medical System, as we create the UM3 Institute for Health Computing. This isn't just a big deal for Montgomery County. It's a major opportunity for the state's economy and educational opportunities. This is one of those game-changing projects that, if putting this in place, is going to enable growth, not just in Montgomery County, but should benefit the life sciences sector throughout the state of Maryland. So we feel that, it's really important that the state understand the significance of this. The health and bioinformatics field is a growing field. And Dr. Suntha mentioned when he announced this deal that, quote, we can become the Silicon Valley of health computing. Nothing less than that is our goal. I'm looking forward to meeting new elected leaders and administrators from across Maryland, and we're all getting ready for the start of the 2023 General Assembly legislative session and the first year of the Moore-Miller administration. Many of the issues that the governor-elect talked about during the campaign are priorities for us in Montgomery County. We're not going to be strangers to each other, and we think that Montgomery County is going to be the kind of partner where if we get a help and we can get some of the support we need, that we can put things into practice and show people that the things we're working on actually make a difference. We just wrapped up a busy holiday season on the roads, and we've got a little bit of troubling information to share. Maryland instituted a new move over law. It went into effect October 5th. 5 police cruisers have been hit by drivers on our state highways and roads. Luckily, these accidents were not deadly and didn't cause any serious injuries, but they should serve as a reminder that this new law is in place specifically to help protect police, fire, and other emergency responders and the public that may be stuck on the side of the road. If you see flashing lights while you're driving, you have to slow down while passing that vehicle. And if possible, you have to move to the next lane over to your left. Unless it's an inside service lane, then you go right. But if it's the outside service lane, you have to move over a lane as you go by the parked vehicle. This is state law. It's meant to protect not just the vehicles, but the people who might be in and around those vehicles. And these 5 incidents are troubling because that's 5 more than we would have expected. So please obey the move over law. Yesterday, the Montgomery County Fire and Rescue Service tweeted out a list of busiest fire stations of 2022. Fire Station 708, which covers Gaithersburg and Washington Grove, received close to 18,000 calls for help, followed by stations in Aspen Hill, Rockville, Twin Brook, and Burtonsville. Just these 5 stations alone accounted for nearly 70,000 calls for help. I applaud the hard work done by all our firefighters and paramedics who help no matter what the circumstances are. And an example of that is just this past weekend, a call for help came from a mother in labor who was trying to make it to the hospital early on New Year's Day, but she couldn't get there. Her baby was delivered during that fire call by ICC, on the ICC, by firefighters, and we're hoping to get an update on how they did in the few weeks when they met up with that mother and with her baby again. We'll keep you updated on that reunion. But it's just one of those nice stories about things that our public safety people do that we don't always necessarily think about them doing. And maybe you see it in the movie, but it happens maybe less often in real life. But this is a real story. We're in the final stretch of a winter coat drive that will wrap up tomorrow. Coats are being collected at the Silver Spring Regional Services Center, rec centers across the county, and the District 3 Police Station. More than 400 new or gently worn coats have been donated as of today, but organizers hope to exceed their goal of 500 coats. So if you haven't donated yet, and if you've got a coat that you're not using, it's out of fashion, you've gotten too small to wear it anymore, it looks many two sizes too big, there are people who could use that coat. So think about coming out to our sites and contributing more coats to our collection. They'll be given out on Friday at the Long Branch Community Center, and I want to thank Silver Spring Cares Inc., Cheer, along with Montgomery County Police, Montgomery County Recreation, and the Silver Spring Regional Services Center for providing this easy and accessible opportunity to help out our neighbors in need. If you can give, please donate and go to this Fund Me account. Remember, tomorrow is the last day to donate a coat or funds to help me or help us with this important effort, and people can do that through a GoFundMe page, and we're going to put that in the chat. And it's https://gofund.me/92F1BC5E. I'm also very happy about the campaign that our Recreation Department has taken on to improve the health and wellness across Montgomery County by offering free fitness passes to residents. In order to improve health outcomes, we've made fitness facilities and programs accessible to all of our residents. So I'm urging everyone to take advantage of Montgomery County's free fitness program, PASS program. All county residents 16 and older are eligible for a 2023 fitness pass at no charge. The pass does not include free access to the aquatic centers, but everything else is free. There are close to 24 rec centers throughout the county, making it easy to find a fully equipped fitness room near work or home. The new year is a time when many people are re-energized to get to the gym or made New Year's resolutions promising that they will go to the gym, and this gives them a no-cost opportunity just to do that. On the health update this week, we know throughout the holidays, we pushed the message of being careful around loved ones and encouraged everyone to get their vaccine boosters. I'm happy to report we saw a slight uptick in people getting their booster shots across Montgomery County. It continues to be the best way to keep our community safe. In December, though, we also saw the most COVID deaths in our county and state since last February. Our community level status remains in a medium category, as well as we have a steady increase in COVID patients needing hospital care. It's discouraging because we know that the new booster shots work. They were introduced in September and they are effective in lessening the impact of the virus. It specifically targets the Omicron strain, which prompted our last deadly wave of the virus. And today we continue to see more people who are unvaccinated or who have not received the bivalent booster end up in far worse condition and in need of a hospital bed than those who are following the CDC recommendations. I've said this numerous times once the vaccine became available. There is really no reason for people to die of COVID. The vaccines are there, they work. They may not protect you from getting infected, but they do protect you from more serious outcomes. And it's present in the statistics. So people need to consider this. The new XBB variant is a little bit more dangerous than the other variants. It clings to your cells more readily than the previous variant did. The preventative medicine that was given to people in order to prevent them, prevent them from getting sick, should they be exposed, that doesn't work now. Some of the treatments don't work with this new variant. So it's more important than ever to get your vaccine, and the only vaccine we're giving out now is the bivalent booster. So I continue to follow the advice of our health experts who are closely monitoring how the virus is impacting our community through hospitalizations and community spread, and they'll let us know if we have to raise our defenses higher. We're not there right now, but we have the tools to protect ourselves. Chief among them are vaccines and boosters. You don't have to wait to your next doctor's visit. As long as you're not showing flu-like symptoms, you can get your flu and booster shots through a physician or nearby pharmacy or through our health clinics. So there are lots of places that you can go and get these shots. The other thing is, we are recommending that people wear masks indoors. We're not requiring it. We haven't reached that yet. But one way of not reaching it is for us to voluntarily, as often as possible, remember to wear a mask. It protects you. If you don't know you're sick, and many people, it takes several days before they realize they're sick, it helps you from becoming a spreader and helps keep someone from spreading it to you. So we're asking, in order to maximize our safety right now, voluntarily follow the guidelines of wearing a mask if you're inside a crowded place. Now I'd like to turn this over to our health officer, Dr. Keisha Davis, and our public health emergency preparedness and response program manager, Sean O'Donnell, for their comments and report. Thank you.
Thank you, County Executive Elrich. You hit the nail on the head there. The most important thing that we can be doing right now is getting your vaccine. Remember that it is bivalent boosters are available for everyone 6 months and up, and you can get them at the doctor's office, you can get them at the pharmacy, you can get them at a county site. So they are available. Remember to think about testing before you go. And we are encouraging folks to wear masks. Again, it's not a mandate, but this is something that we know in Montgomery County has been shown to be really effective to prevent the spread. And with that, I will turn it over to Sean, who will give us our current statistics.
Thank you, Dr. Davis. Okay, to go through some of our latest data, I want to share that this is the multiple year look at the impacts to our Montgomery County hospitals from respiratory illness that presents with a fever. So this is what we have in the past called flu-like symptoms, but it certainly can include anything from COVID to influenza to RSV. The pink dots are showing this year's illnesses. As we've talked about in the previous few weeks, we saw a much higher level of hospital visits for those types of illnesses. Much of it was driven by RSV over the past few months. We've now seen a few weeks of that level coming down. You can see the light green that kind of has risen above it. That was last year's Omicron cases, the very, very large number of cases of Omicron. So you can see we're starting to see a little bit of a receding of the overall number of respiratory illnesses people are going to hospitals with. Our hospitals are still very crowded, however. When you look at those types of illnesses with relation to ages, again, you see some of those decreases are being driven by our youngest populations having fewer cases of RSV and related type of illnesses. You can see it's still elevated compared to previous months, but it's coming down from very, very high levels over the last few months. Unfortunately, though, with our family gatherings, with visiting our relatives and people we care about, we're starting to see some of those illnesses now tick up in other populations. Again, these are hospital visits. So this is fairly significant illness, and you can see our 65 plus numbers have started to go up quite a bit. Looking at the surveillance from some of the other jurisdictions on the East Coast, we continue to see New York City significantly elevated compared to, say, Boston, Philly, and our region. In all of these areas, we saw a little bit of a decrease in community level COVID transmissions. I do want to caveat that for many places and in many communities, during those holidays, you have fewer people coming out to get tested during the holidays. And so that may be why we saw a steep drop off there for a few days, and now potentially a leveling or going back to an increase. Looking within our county, you can see on the right, the lower right is our percentage of hospital patients who have COVID, and that has gone up somewhat. Conversely, as the percentage of hospital patients who have other diseases are going down, you see more and more, a higher percentage of patients that remain are COVID patients. But you also see our new patients with COVID numbers, that's the upper right, that has been steadily going up. So we are definitely in a position where there's increased COVID transmissions going on. As our county executive covered the latest news about the variants, again, they pose an increased risk for our immunocompromised populations. But again, these are all subvariants of BA.5, which is one of the Omicron variants, which is what's in that bivalent booster. We want to differentiate that the latest booster is a different type of vaccine in components to all the previous boosters or first and second doses. That's why individuals are recommended to get this one, even if they had a previous booster. Looking at the hospital numbers, you can see the gray shaded area is the total number of hospitalizations, including our alternate care site. And we're at a higher level now than we have been the rest of the year. Going back, you'd have to go back to almost February to be at a level we're at now. And this is just COVID patients. So you can see that is impacting our hospitals, with the total number of patients. As we've seen those increases, we have unfortunately seen increases also in the mortality data. We had the most deaths here in Montgomery County and in the state since going back to last February when that initial Omicron affected us. So again, this is why COVID remains a consistent and deadly disease in our area. This is the combined mortality from pneumonia, influenza, and COVID, and it's nationwide. We're significantly elevated from where we would expect to be, and most of this is being driven by COVID. Moving on to some of the other diseases. Again, we've mentioned RSV continues to come down. It's the purple peak there that was very, very large this year and early has now started to recede significantly for multiple weeks. Influenza continues to tick up across the nation. There's now been 13,000 deaths across the nation from influenza. Hospitalization rates continue to be high for influenza. But it is a lower impact than COVID. We've now started to see influenza positive cases start to come down across the U.S. In Maryland, it's the yellow curve there that it continues to come down in Maryland. But the total number of deaths across Maryland is now 27. Again, when you think about the impacts to influenza, and influenza is a serious and deadly disease. It can lead to pneumonia, which causes many, many, many more deaths. But it compared to 27 deaths across the entire state of Maryland, we've already had 41 deaths in December for COVID alone. So you see there's a huge disparity in what COVID is doing, and it's why we continue to talk about it and continue to recommend people get that vaccination and wear masks if they're around individuals at higher risk. Our vaccination rate for influenza is amongst the highest in the state, but it is still in the about 34%, of our residents have gotten it. Again, anyone 6 months and older can get a flu shot. So lots of people who could take advantage of this, we're still recommending that they do. And then finally on to Mpox. I'm happy to report the state of Maryland has had no new cases reported over the last week, which is certainly good news. We're still providing vaccinations and still being vigilant on this. There are new cases across the country, but we've definitely entered a period where this appears to be in well controlled in our area. At this time, I'd like to see if Dr. Stoddard had anything he'd like to add as well.
I don't today. I think we can proceed to the question.
Okay, so we're going to open it up for the Q&A portion of this presentation now. Members of the media, remember to use the chat at this point, and we'll wait a couple of seconds to see who has questions this afternoon. Steve Bonnell, Bethesda Beat, you have questions for the public safety, about public safety for the officials. Go ahead, Steve. Good afternoon.
Happy New Year, everyone. I think the county executive and Dr. Stoddard probably best poised to answer this. I just want to follow up. We were discussing the new police station last week. And I just want to get, what was the kind of impetus for this? I know this was kind of years in the making. I've learned, did this start with reimagining public safety, or was it even before that?
Yeah, the genesis for this was the police department conducting a work analysis, essentially, to understand exactly where calls for service are coming in across the county. And that workload analysis, we believe, is likely to indicate to us, based on what we anecdotally know about the district, that the 3rd and 4th districts, particularly, which are the Silver Spring district and the Wheaton district, have a disproportionately high number of calls that are answered. And so we think that was the genesis of it. It's been going for about 6 months. We expect it to wrap up in the early spring, and that'll give us a lot more information about where we proceed to in terms of the mapping of the district.
Sorry,
Steve, I'd also add that, this is something that people talked about even back when I was on the council, as something we might do to realign ourselves. So this didn't have anything to do with what happened in the shooting. We were talking about this already, and the solution may or may not be a station, which is why it's a study. So, and the study doesn't presume that there's a station in Silver Spring. It's looking at the layout of all our police resources and what's the most effective way to manage them, and what's the most effective way to ensure that the police staffing matches the load the different districts have to carry in terms of policing responsibilities. So there's no conclusion yet because there's no completed study yet.
So I guess,
but don't hurry this thing forward prematurely.
But I guess moving forward, though, at the middle of this year, whenever that study wraps up, what are some of the other potential solutions besides a new police station?
Well, but just, frankly, increasing our police staffing would go a long way. That's why we're encouraged that this recruit class was the largest we've had out of, of the last 3. This is actually closer to what was normal, and we want to continue to make sure that we're competitive so we can attract police officers here. I think, it's hard to have the department run at maximum efficiency when they have the number of vacancies that they've had. And so this would help us, more effectively deploy people. It would move some of the concerns about shifting officers from one part of the county to another part of the county and weakening coverage in one place to beef it up in another place. If we had a normal complement, this will move us, I think, in the right direction. And then, we've done a lot of other things. In, Silver Spring's a good example. There are cameras there that were never there before. There's a level of, of work being done by the police that's at an intensity that is, has not happened in the past. So we're trying to match resources to where problems are. And we understand there's, multiple ways to deal with this.
Thank you.
The one thing I with that, Steve, is in addition to police officers, which everyone thinks about, there are a lot of resources that support the overall effort for law enforcement. There are crime analysts, there are call takers and dispatchers. Those dispatchers are actually assigned by district to dispatch for that district. So if you have a couple districts that are way larger than the other districts, they end up having to do more dispatches, and it can delay the dispatching if it's not efficiently done. So that's part of this analysis. It's really going through the entire law enforcement, public safety process, from when a call for service comes in to its dispatching to it arrives on scene, the response time, as well as the non-response calls, the community service officers, the analytics that go into that. Those are the things that are really involved in this study overall.
Thanks, Earl.
Thank you, Steve. Up next, Mariam Shahzad, my MCN. Good afternoon, Mariam.
Good afternoon. I want to ask about the migrants that are coming in from Arizona and Texas. It looks like more buses came to DC around Christmas time. Just wanted to ask what that's looking like for the county and if you have any numbers.
So we've had a near constant 50 individuals staying in the, not the same 50 individuals, it's 50, 50 come in, some go out, some come in. And that's been the county's participation. And when I say participation, it's largely we've been providing the location, and SAMU Response International has largely been providing the personnel and services inside the respite center. The county has been heavily involved in the transition for those who end up staying in the region to the location and nonprofits that support that location. So for example, CASA and other organizations who provide support for people who stay, the county has been helping with the bridge between SAMU and the respite center and those people who end up staying. The vast majority, 90%, 85% or so, end up traveling to a further destination. So they're really only in the region or in Montgomery County for 3, 4, 5 days.
Thank you, Mariam. Any more questions from members of the media? I do not see any more requests for questions on the chat, so we'll give it a second. Anybody else? All right, going once, going twice. I think we're done this afternoon. Thank you, everybody, for joining us. Stay safe. Have a great afternoon. We'll see you next time.
Thank you. Have a good